And other questions, don't hesitate to chime in as you go along. Good. And also from last week, hi.
Hi.
How are ya?
Fine.
Can you give us a report?
If I'm fine. I just think my biggest problem is I miss my son, so it's very difficult to distinguish how I'm feeling because I miss him so much. But
Come in the house.
as far as the surgery goes, I think I'm fine.
But you have a little been sad and tearful?
Oh yeah.
Have you tried this?
That's what he said. He said you got
Well,
I said stop bringing up the hormone, that hormone.
how is it you know that it's not hormones?
Because it's perfectly logical that I'd be missing my child.
Right.
It's
That's
not.
true, but
I'm
we
not
have-
like a lunatic throwing things across the room.
Well, but hormones doesn't mean you're a lunatic. But you have been tearful and crying because you're missing your son, right? Well, now, remember, we expect your estrogen to drop. And we know that that has a powerful effect on people's emotions. Is there a reason you don't want to just try the estrogen patch?
Well, I was just watching this special about, it was one of those commercials that says, if you've taken the estrogen patch, Depo-Provera, Premarin, or Prempro, please call the law firm of so-and-so.
Well, that's good. Let's talk about that. That is right, because what those lawyers are trying to do is find a doctor who gave a lot of estrogen, and then a woman who has a cancer that might be associated with estrogen, so they can sue that doctor, which, you know,
Yes.
of course, we love those lawyers. But let's talk about that concern. In other words, one way we could refocus this discussion, we could ask the question is, what is the risk of an estrogen patch for 7 days or 2 weeks? Well, first of all, there's a kernel of truth in the kind of greasy law firms' ads on the TV. In other words, because high estrogen is associated with cancer, okay? When you came to us as a heavy woman, you were full of high levels of estrogen. And so we can predict from the scientific studies that you have an extremely high risk of getting breast cancer and endometrial cancer, okay? That was not because, so the lawyers can't sue somebody and make money if you get breast cancer from your own estrogen. But that estrogen that your body has been creating up until your surgery the other day is still the same cancer-causing, or better to say, cancer-associated hormone.
So you think I should just slap on the patch?
Well, you're ahead of me. Let me finish. So you arrived here, and all the other heavy women who come to see us, you arrive here, you bring to us extremely high levels of estrogen. And had we not done the surgery, your lifetime ahead of you would have been filled with a significantly higher risk of breast and endometrial cancer. Now, having had the surgery last week, your estrogen is plummeting. It's going down. It's going back to normal. The estrogen patch may help normalize that because the body is used to very high levels of estrogen, and they're going to change right after our surgery, okay? They're going to drop precipitously. And the rest of your future is really bright because we expect a significant drop in breast and endometrial cancer because of dropping that estrogen. And you won't get an opportunity to call the lawyer and say, hey, I got breast cancer and because I was obese and had lots of estrogen. And he says, well, I have nobody to sue for that. So he's not going to help you.
And I also heard that it makes you bitchy,
The low estrogen?
or like the patch.
No, it's the cure for bitchiness.
Oh, yeah. I was going to say, I've got a natural bitchy enough. I don't need any extra bitchy.
Low estrogen is... so, back to what makes a woman witchy with a B. Low estrogen. That makes you sad and tearful. That's why you know some experiences. You probably know people who go through this. Have you seen someone go through menopause?
Yes, my mother.
Okay, how was that?
She was a nightmare.
Okay, that was not because she had extra estrogen. That's because she was getting to the end of the function of her ovaries. Excuse me. And that made her grumpy because she was withdrawing them. Now, as we talked about, back to the attorney's ad that you saw on TV, high estrogen can be a dangerous and potentially deadly problem. And your surgery is dropping that estrogen. So that's wonderful news. But it's somewhat similar to quitting smoking. You know, smoking causes lung cancer and all kinds of problems, right? So if you quit, it's a time for celebration. We say, you just quit smoking. Yeah, great, congratulations. But I just don't want to be near you when you quit, right? Because when you withdraw that nicotine, you can be a little grumpy, right? I'm happy for you that your long-term risk of lung cancer is going down, okay? Now, what about the estrogen patch? Like the nicotine patch, it can smooth the transition from high estrogen to low estrogen. So the nicotine patch is not something you use permanently. If you do use it permanently, then you get to call the law offices of Solikoff, and Solikoff in Pennsylvania and sue some doctor. But in this case, you came with high estrogen, you're going to leave with low estrogen. All we're saying is for a couple of days, we can turn your recovery from an awful, crying, sad, annoying experience into a more pleasant. Okay?
Okay.
That's a good question, and we hear this problem all along, so you're not unusual. So, do you want to take your staples out?
Sure.
Do you mind doing it in front of everyone?
No,
All
I
right.
don't care.
Come on. Maybe stand right here where I am. Oh, looks good. Applause, everyone. Real still.
Are you sure mine aren't going to hurt? Because they look like they're in there.
Well, you look at the camera. You look at the camera and you say, "You take my name in vain if it hurts," right? Dr. Rutledge, you son of a gun. Then I'll put that on the internet. Hold still. Stop moving. How was that? A lot of people worry about the staples. That's why we appreciate you volunteering to have us take it out, because, you know, people are frightened about this. And
I'm a big wuss.
yeah, there you go. So, you know, you're sensitive to pain, so that's all right. And they're not hurting too much?
Not at all.
Good. You notice I'm not touching you at all, so in case I have some terrible bacteria or anything, no touch.
Okay.
All right, applause. Congratulations.